For me, what makes a great preceptor is someone that takes the fear out of these new experiences. Coming into this program, everything's new for me. My preceptors have always been very communicative. They tell me what I can expect. They take me by the hand and guide me through new experiences, and just always find opportunities for me to learn along the way. A couple of quarters ago, I had a patient that was declining, and I wasn't quite sure what was happening, but I knew it was bad. And so I pushed the staff assist button, and the nursing manager came in and responded and pushed the code button. And I wanted to flee the situation. I just wanted to get out of there. It was really scary. But my preceptor found me and gave me a pep talk and encouraged me, and she pushed me right back into the room because she said, "You were the one that was there with your patient. You need to communicate with the doctors." And however difficult it was, like, she let me know that it was important that I was there and that I was a part of the team, and she just let me know that I could do it. And from then on, I felt a lot more comfortable just interacting on the floor.
In my experience, what makes a great preceptor is someone who makes you feel welcome in the team. Sometimes it's really hard for us. When we are in a different environment, we don't want to feel like we're bothering someone. We don't want to interrupt their time, and if they just make us feel welcome, that is just absolutely great. We are given the opportunity to ask questions, and just that warmth, it's pretty valuable for us.
One of the things that I appreciate about a preceptor is if they have been working for a long time in their field, they generally have a wealth of historical knowledge of the changes that have happened over time in their specialty or in the kind of work that they do. I've seen this especially with nurses that have been involved with HIV since the epidemic sort of emerged, and I think that historical context actually gives me a greater depth in understanding the changes that we are going to see in medicine and what we may lose, what we may gain, but just understanding how we got to be where we are in medicine and why we know what we know and why we do what we do, and what we need to do in the future.
One thing that makes a great preceptor is treating the student like a peer. There's a hierarchy in education where sometimes we're expected to perform a certain way in the clinical situation, but a preceptor who really calls us to the table as their peers and asks how we're feeling and checks in with us is a wonderful teacher.
Really the value in having a great preceptor is being able to witness and practice and really be able to hone those skills in terms of connecting with our patients. Not only are really knowledgeable about their respective fields, but they just have a certain air to them that really shows that they care about their patients. The families that receive care from them really feel listened to, they feel appreciated, they feel loved by these clinicians. And being able to be in clinics and watching that really motivates me and drives me to be the best provider I can be, so that I can make those same connections with the patients that I'll care for later in the future.